when you look at estimates of some of these other sorts of similar fearful types, shyness, withdrawal, fearfulness, there's a number of studies that have shown correlates of around sort of heritability estimates of around 0.5 to 0.8. So again, 50 to 80% of the variance. So the indications are perhaps, which again surprised the hell out of me, I must say, it's perhaps indicating somewhat higher proportions of variance accounted for by genetic factors in measures of temperament than in measures of disorder. Now, the but side of that is, of course, once again, two things. First of all, measures of temperament tend to be based very commonly on parent reports, and parent reports tend to maximise heritability estimates because they tend to emphasise contrast between different twins. In addition, that idea that I was saying before, that measures of temperament are based on words that are more trait-like, and measures of disorder tend to be more state-focused. And we know that trait-like measures tend to have higher heritability estimates. So it may not be, once again, the constructs have greater or lesser heritability, but rather that the way in which they're measured may reflect that. One of the other perhaps slightly better bits of evidence is studies that have tried to look at temperament and disorder within the one study, and there's very few of these, but there are a couple of studies primarily done with adults that have looked at heritability for neuroticism and heritability for disorder, anxiety disorder. And in those couple of studies you do tend to find slightly higher heritability estimates for neuroticism than you do for anxiety disorders. In addition, you tend to find once again that it's social phobia and generalised anxiety disorder seem to have the greater overlap in genetic variance that's common with neuroticism. So the sort of the sets of genes that seem to be important in neuroticism appear to share most commonality with the genes involved in social phobia and generalised anxiety disorder, much less so for panic disorder and specific phobias. Okay, next hypothesis would be that anxiety disorders, if they're different to temperament, should be more responsive to external types of factors, like, for example, interventions and environmental influences. Once again, there's not a lot of this sort of work, and I know Dina's going to talk about some of her work with this later on, or tomorrow, but a couple of studies I found that looked at sort of comparing changes on temperament and changes on disorder within the one treatment study. And there was one study with adult social phobia done by Mortberg and colleague recently, and they ran a standard CBT intervention for people with social phobia, adults with social phobia. They found that it was a highly significant effect on anxiety disorder, on social phobia itself, a greater than one standard deviation effect. On temperament, they also found a significant effect, but it was much smaller, less than half a standard deviation effect. So the influence of the treatment on temperament was much less than the influence of treatment on disorder. A small study by Sheba looking at kids. They had a small group of 40 kids that they sort of rated as difficult temperament, this sort of very broad temperament style of difficult temperament. They ran a parent training group with the parents, with the mothers, and what they found was that internalising symptoms showed a significant decrease, significant effect on disorder symptoms, but no effect at all on the difficult temperament. Difficult temperament remained the same, symptoms decreased. I mentioned earlier that we've done a couple of intervention studies, and in one of those we got similar sort of effects. The other one we didn't. But in one of ours, a much larger study looking at 146 kids behaviourally inhibited. So these are kids whose mothers reported them as high on shyness, and then in addition they showed behavioural inhibition. They got into behavioural inhibition category, if you like, on laboratory assessment. They went through a parent, or the parents went through a parent intervention, and we then gave a structured interview of anxiety disorders, and we found a significant decrease in anxiety disorders, but no change at all, no differential effect on temperament. There was a change in both groups in temperament, but no differential effect, no greater effect with treatment, that is no treatment effect on temperament, but a very significant treatment effect on disorder. A second study that we ran more recently didn't show that difference. In the second study we got effects on both, and I'm not quite sure why. But we had 71 kids. In this case they were much more extremely high on both temperament and disorder. So these were kids who were particularly high on shyness, 2 standard deviations above the norm, and also had high behavioural inhibition. And in addition, they had at least one parent with an anxiety disorder. And so this very extremely high-risk group, we gave parent intervention to the parents and found significant decreases on both disorder and temperament. And effect sizes are about the same for both. Not quite sure why of that. Oh, this is just typical bush scene. Thought it's probably time to throw in a photo. It's getting heavy. Okay, so this is just typical bush scene in Australia. Nice eucalyptus forest. Okay, so I guess summarising in terms of some of the different areas, different hypotheses. In terms of description, there seems to be, obviously there's overlap and there's common items, but there's also some fairly obvious differences. The differences may reflect developmental differences or perspective differences, trait-state type differences, but nevertheless there are some clear sort of different ways of describing the construct. The correlations are clearly less than 1, and perhaps to me I would say surprisingly low correlations, particularly when you remove common items. It could be, of course, measurement error that accounts for some of that, but they are really quite low correlations, so you'd need to say that the measures are very error prone to account for all of that lack of unity through measurement error. It does appear to be possible to identify people who are high on temperament and don't have disorder, which again suggests some disunity. Stability is the one hypothesis that doesn't indicate difference between the constructs. The level of stability between disorder and temperament appears to be pretty similar. In the genetic research, you find hints for slightly stronger influence, genetic influence, or greater amounts of variance accounted for by temperament, and that the contribution to neuroticism and anxiety disorders are not the same genes necessarily, and are more similar for some disorders than for others. And it does appear to be harder to shift temperament in terms of intentional interventions. It may be that, once again, that reflects the trait conceptualisation of temperament, that when you conceptualise it as a trait and you measure it in that way, that of course you don't see the treatment shifts that you would see with disorder. But it does appear to be harder to shift those. So, broadly speaking, the area basically has got a lot of methodological questions and confusion. We can't necessarily say much. There's a lot of confusion lack of disagreement or lack of agreement about subtypes of temperament, about the best measures. It's difficult to compare temperament and disorder across studies because of different raters, different ages of assessment, maturity levels, state trait focus. And so we can't necessarily draw any strong conclusions about whether we're really talking about different constructs or not. And then clearly we're talking about constructs that are very, very similar at the very least, and are very closely related. But it does seem that there are enough hints, there are a number of hints in the literature that do suggest that, at least as hypothetical constructs, temperament and disorder are perhaps somewhat different things, so slightly different types of constructs. And they can be distinguished, usefully distinguished. And there do appear to be differences between disorders. So you do tend to find that social phobia and generalised anxiety disorder are perhaps more closely linked to temperament and are perhaps more personality-like or temperament-like disorders, whereas panic disorder and specific phobias seem to be slightly different types of constructs. And more, I think, to me, more importantly, in terms of what are the differences appear to be largely to do with a tendency or an ability to be able to control or ignore or deal with the symptoms, and hence the degree of life interference or impairment that the symptoms produce. Greater impairment, greater life interference from the same set of symptoms appears to be more characteristic of disorder and then different to temperament. And I'll leave you with this nice scene as you're coming into your summer. Think about this typical Australian beach scene. All right, that's I'm done early. All right, thank you. Good luck with that. I'll leave it on that.